season to give, and yes, 'tis the season to be thankful. And I got to tell you, I'm thankful that this gentleman is now joining us live in the live zone. Of course, I'm talking about Dr. Minna Mir-Holm right here in the LZ. Good to see you, sir.
Oh, great to see you. I'm glad, so happy to be here with you.
I'm so happy too. Normally, it's kind of you're on the other side of that screen, and I'm here, but now we have you in person, so it's a good thing.
Live in the flesh, nothing like it. It's the best.
I love what you're focusing on, because during this time of the year, so many times we think about, well, receiving and not necessarily giving. And we should all think about giving in a major way. But not only giving, guess what, folks? When you give, it helps your health.
That's sure is right. That's sure is right. That's one of the things that we love around this time of year. Thinking about the data, we've known for a while that, hey, just having a grateful disposition is really helpful socially. You know, you love to be around folks who are like that. But what's been amazing, really, is we're seeing how this has a measurable impact on your physical and on your mental health. We've been able to see some amazing studies, and that really encourages us to make a practical effort to live a life of Thanksgiving.
All right, let's talk about this whole anxiety thing, because, I suffer from that a lot. Let's talk about this whole depression thing. No, not necessarily as of yet, but I can see that happening. So with that being said, how does giving really play in all of this?
Yeah, you know, so the holidays can be a tough time for people who are struggling with anxiety or depression in general. So my patients often ask, what are some tools besides medication and therapy? And one thing that we've seen that really helps anxiety and depression is taking ourselves out of ourselves in a way. Thinking about other people, focusing on them, a volunteer opportunity, being in a local soup kitchen, being with folks who are struggling. That in itself, the data has shown us, volunteering, helping others really helps us in return, which is pretty incredible.
Yeah, I'm thinking back to losing my grandmother. We were just talking off air about you being from the New York area, my grandmother actually being from New York as well. During this time of the year, I think about her a lot. And so I would assume that so many others are thinking about their loved ones that are perhaps no longer with us. Yet again, giving can help, let's say, relieve that anxiety and or that stress?
Absolutely, because, you know, when we think about loved ones, we think about their legacy, right? We think about what is it that they left us with, the part that they imparted in us. And one of the ways that we can keep their memory and their legacy alive is taking their attributes, taking the things that were so amazing about them, being joyful, being kind, being loving, and doing that in the way to honor them, right? To carry on what they've given to us is a really beautiful way to sort of manage the grief around the holidays. Because it can be very tough to think about someone who was here and is no longer here, but this is a way to keep their memory alive.
Yeah, you made mention of the scientific evidence, if you will, and folks watching saying, hey, I got to know about that evidence thing.
Right.
The proof is in the pudding.
That's right.
So I'm hoping you can elaborate on that.
Absolutely. One of the studies that I've been most excited about is in a huge journal called JAMA Psychiatry, and this looked at over 49,000 people. And just, they wanted to ask this question is, all right, we know that gratitude is nice and it's an attribute we'd like to have, but does it make a measurable difference? Will it make someone actually live longer? And they were actually stunned, because this was the first empirical study to show you can live 9% difference there on your risk of death, or what we call all-cause mortality.
Wow.
Which is incredible when you think about, hey, if you stop smoking, that can decrease your mortality risk or risk of death by maybe 20%. If you can do something that has no side effects, no pill, and you can just choose to do actively, it can have that much of an impact on making you live longer. It's incredible.
Wow, I absolutely love this. I got to tell you, you're putting a smile on my face, and I'm pretty sure we're going to put a lot of smiles on these faces, but folks that are watching at home when we talk about this, and that is family gathering together come Turkey Day, which happens to be tomorrow. You know, there are so many stressful things surrounding that. Let's say we start talking about politics. Maybe not the best thing to do.
Right.
Let's say we start talking about sports teams. I know I'm a Commanders fan. You hailing from New York, I would assume perhaps you might be a Giants or Jets fan.
A struggling one, that's right. It's been a tough year.
All I'm getting to is that, well, there could be some tough conversations at the dinner table, and it's probably best that we try to avoid that.
Yeah, and there's been a lot of conversation around that lately of, well, you know, there's a lot of sensitive conversations. Maybe let's just steer clear of that and just enjoy our time. This is one of those times where I like to say to patients, you can count your blessings and also share your boundaries, right? So maybe there are some things for you. I'm not ready to get into this particular sports issue, or I don't want to get into who I voted for. But at the same time, I want to be able to say, where's the common ground between me and my family? Oh, you love the Commanders, you love football. We can bond around the fact that, hey, it's a great sport, or around the fact that, hey, you know, we've had quarterback struggles over the years. So figuring out where there's common ground in family, it's not hard to find. You just got to look for it. And that's the same thing with gratitude too. You got to train yourself. You actually rewire our brain to look for the positive, look for the common ground, as opposed to looking for division.
I absolutely love that. Yet again, the whole common ground thing, it's something that Well, nowadays it's pretty hard to find.
It is, because we've been sort of conditioned in some ways. Our algorithms, are conditioning us or asking us to be divided, to be upset, to be responsive, but there is a way that we can do it differently.
Yeah, all right. One of the cool things about having a doctor in the house is that I can ask as many questions as I want. We're going to switch gears in this case. We're going to talk about the actual food that many of us plan to eat tomorrow, okay? I'm raising my hand, those smothered pork chops I don't normally eat. I shouldn't be eating them according to the doc, but a lot of folks plan to do just that tomorrow. Is that something that should be of concern if you know that perhaps you need to be in the gym a little bit more, but daggone it, I'm going to go full steam ahead tomorrow and eat all I can?
Well, it's understandable, right? There's the founder of medicine, actually, who was credited to be Hippocrates, said, "Let food be thy medicine and let medicine be thy food." So there's a big thing for us in psychiatry of nutritional psychiatry, which is your food impacts your mood. So it is understandable if we're going to overindulge and have a whole bunch of turkey, but then we're not surprised when we're a little sluggish for a day or 2 or 3 afterwards.
Yeah.
So the question for us can be, how do we make sure we're enjoying time with family, enjoying the food that we really love in some moderation when it comes to food, as well as alcohol too is another area that we can touch on, because we want to know that a lifestyle of overindulging puts us in a place where our mood is impacted. So we want to practice some restraint, some moderation whenever we can, while still enjoying a holiday like this, which is so wonderful.
Yeah, you must be a mind reader as well, because you know exactly where I'm going with this.
I got you, guy. You're my guy.
Alcohol.
Yes, sir. Yes, sir.
I've already bought a couple of bottles of wine that I plan to open, not just for me, but for my entire family. Once again, everything in moderation, but I'm pretty sure a lot of folks tomorrow will probably have a little bit too much to drink.
That certainly is true, and we know from the data that alcohol sales around Thanksgiving and the holiday time is up around 156%.
Wow.
So it is no surprising. And I always tell patients there's a difference between when we're drinking to enjoy the company, when we're drinking socially to be able to be part of an environment, versus sometimes we're self-medicating. Sometimes we're so anxious around family that we need to have a bit more to drink, or that we're really treating something that should not be treated with alcohol, because biologically, alcohol can help you be a little bit calm. But, as we know from even the social media or the popular media songs, that you can form habits that way. You can form problems that way. And that's the part we want to be on the lookout for, is to know, am I drinking to have a little bit of a good time, or am I medicating something that should be treated otherwise?
Yeah, and obviously if you do happen to partake in an adult beverage or two, make sure you do not drink and drive. We really want to reiterate that as well.
Absolutely. That's a big thing. And if you're struggling with alcohol use before the holidays, and the holidays are a tough triggering time, make sure to prepare. Have some things in place where maybe you're going to a meeting beforehand. Maybe you're checking in with your doctor or therapist to say, is there a medicine I can take that can help me curb my cravings? Because for folks who are already in a spot where a little bit of alcohol can be really problematic, this is the time to be cautious before going into that environment, not reacting to, well, now I'm sort of in it and I have to just take a sip or two and see what happens.
Yeah. Wise words yet again by Dr. Mena Mirholm. Of course, he might have 1 or 2 drinks more than me, because as we know, he happens to be a New York fan, whereas we're going for the Commanders.
It's been a tough year for us. We're happy for the Commanders, though. We really are.
I had to poke fun at you, sir.
We deserve it.
Good to see you. Glad you came in studio. We got to have you back, sir.
Absolutely. Love being here. Thank you for having me.
You're welcome.
Happy Thanksgiving.
Same to you, buddy. All right, guys. We'll take a quick break, and we'll be right back.